With New South Wales and Victoria making progress on their roadmaps out of lockdown, experts are warning the poor mental health legacy left by the pandemic could be much bigger than anticipated. Health practitioners who've experienced other international health emergencies warn that post-pandemic anxiety can last for years.
In 2003, an outbreak of the SARS virus hit Hong Kong, spreading quickly and causing chaos and trauma for many on the front lines.
Everything happened very fast. Really, it was just like a tsunami.
Intensive care admissions tripled in the first week. Dr Lily Chu worked tirelessly to support her staff.
To make them feel that they don't need to feel lonely, isolated. You just put me in the front line and you leave me to fight to die.
Over 10% of those involved in the SARS outbreak showed signs of PTSD, but mental health experts say COVID-19 is a much bigger beast.
If we look at countries who are ahead of Australia in terms of vaccinations and easing restrictions, even there we see that the anxiety and depression, loneliness is actually increasing, as well as the suicide rates.
Melbourne resident Spiros Vasilakis has anxiety every time he hears the daily case numbers.
It is traumatising. It is traumatising because it just doesn't let up.
He lost his mother to COVID in July last year. He later also contracted the virus.
Mentally though, it's drained. It's drained me. I tried to go back to work. I just wasn't in the frame of mind.
I can't refer anyone to private psychiatrists. Most of them have closed their books.
Dr Stacey Harris says GPs, hospitals and mental health specialists are overwhelmed. ABS figures show 1 in 5 Australians are reporting high or very high levels of psychological distress linked to the pandemic. In Victoria, the statistic is even higher. Those most affected are women, younger Australians and those with pre-existing mental health conditions. Distress that continues even when case numbers are low and lockdowns are lifted.
Things sort of got back to normal in January, February, but I was still seeing people that didn't get help last year with the lockdowns, and they were coming in now saying, you know, look, I know it's after the fact, but I'm really suffering.
Mental health experts predict a significant proportion of the Australian population will be left dealing with the psychological fallout of the pandemic, some putting that figure as high as 20%. But they say Australia can benefit by watching countries like the UK that are further along in analysing the mental ill health legacy of COVID-19.
1 in 4 people are still reporting marked loneliness, and it is going to be an issue because people are not just going to go back to the world or the life that they had before COVID.
He says now is the time to put in place sustainable support programs and set a mental health roadmap out of COVID. Abby Dinham, SBS World News.
And if this story has raised issues for you or someone you know, you can get support from Lifeline at any time on 13 11 14.